Almost half of Australians will experience a mental illness in their lifetime.
For every person with a complex mental health problem, there are at least 5 other people around them that are affected.
Only 46% of people with mental health problems access treatment.
St Vincent's is based within an area of extremes. We have a high proportion of patients that have some significant vulnerabilities, and it's crucial that we can support them here at St Vincent's Mental Health Service.
Mental health can hit anybody at any age, from very young to very old.
The first time I noticed that I had a mental health problem was when I was about 16, and it was the first time that I started self-harming, and that led to my first suicide attempt.
I first became aware I had a mental illness when I was 60. I had a major manic attack and a major manic episode and finished up being hospitalised involuntarily.
When I was 24 after my second attempt, and that was when I was in care here at St Vincent's, was when I really learned to manage things, and they're skills that probably took a long time to perfect.
I've had 3 major episodes. The first one was undiagnosed and untreated, and I was lucky I didn't kill myself. The second 2 I finished up in hospital, so that's a different scenario.
I think it impacts people in terms of their socialisation, their employment and education, in terms of their physical well-being as well. So it's really, it can impact every area of a person's life, and I think it's our job to make sure we're not just addressing the symptoms, but we're supporting patients through that whole journey.
PARC most certainly will be a game changer for our service here at St Vincent's. PARC is what we call a recovery centre, so it will be a step up, step down facility for either patients in the community who don't quite need hospital treatment but require some additional support.
In terms of the step down, often patients will stay with us for a short period of time on the ward whilst they're acutely unwell, and then they may improve but might not be quite ready to go back home. So the PARC will offer an opportunity for them to spend some time, I guess, getting used to not being in the hospital environment, but sort of moving on into the community.
It's something that's missing. I think the acute facilities are fine, but you need a lead in and a lead out, which are not there at the moment.
Look, I guess primarily it's to improve the patient journey. It allows us to increase the amount of support that we can give some of these patients while they're in the community at times that they might need that little bit extra, and hopefully avoiding keeping them in hospital for longer than necessary or at all if we can.
Mental illness is just an illness.
No one should live with a mental illness on their own. You can help.